Hello students, this is Vamshi Krishna. Welcome to my YouTube channel. So in this channel this is my first video. So in this video you are going to see some of the golden points for the practical examination in fundamentals of nursing. So after some days you are going to face the practical examination for the first year BSc nursing students and as well as GNM students. So in this video we are going to see a basic points to be remembered for the viva questions of fundamentals of nursing practical exams. So the first question is, what is the definition of health? So what is it? So these questions the external and internal madams they may ask in the practical examination. So the first one is what is the definition of health? So the definition is it is a state of complete physical and social spiritual well-being. Okay, this is well well-being in and not merely absence of disease or infirmity. It is nothing but the person should be physically, mentally and socially, spiritually has to be well, I mean good condition, and in any area there should not having any kind of infection or disease. So this is the definition of health: a state of complete physical and mental, social, spiritual well-being and not merely absence of disease or infirmity. This is the definition of health. The next question is what is nursing? So this kind of questions the teachers may ask in the practical exams. The profession or practice of providing care for the sick and infirm. So nursing is nothing but we are giving it care. Okay, we are giving the care by practicing and providing health services for the sick patients. So that is nothing but nursing. So the nursing is nothing but giving a care for the illness. And the next question is what is disease? Okay, disease, an illness that affects a person, animal or plant. So disease is nothing but it is kind of infection or deformity or deficiency, whatever it is. Okay, it is nothing but illness, not well-being, that affects the person means human being, animal means the pets or animals in the wild, and the plants. Okay, this is plant, an illness that affects a person, animal or plant. So this is disease. So the next one is what are ethics? So in the nursing profession we have some ethics. Ethics are nothing but values. Okay, what is good and what is bad. That is, so moral principles that govern a person behavior or the conducting of an activity. So ethics are nothing but the values what we are following in our daily life. What is good and what is bad. So that is ethics. And the next one is what is the meaning of nurse? So what as a nurse, so you have to know about the meaning of nurse. So which means that nourishes and protect. So the nurse is nothing but nourishing. Nourishing means giving energy. Okay, and protect from the illness or infection, whatever it is. Okay, that is nothing but nurse meaning. The next one is what are the functions of professional nurse? So as a professional nurse, what is your functions? Okay, what are your functions? What you have to do as being a staff nurse? The first one is a, so if the madams ask regarding if they ask this type of question means you have to give this, you have to give the these points to provide basic nursing care. So as a nurse you have to give the basic nursing care for the patient. And the next one is to observe the patient's response and adaptation to the illness and the treatment. So while giving a treatment for the patient you have to observe the changes. Okay, how the patient is reacting, how he is going to give response towards the treatment, and adaptation is nothing but towards the treatment. Okay, receiving the treatment, that is nothing but adaptation to the illness and treatment. So the next point is to administer medications and treatment as prescribed by the physician. So as a staff nurse, you have to give the medications and the treatment. So what the doctor has prescribed, I mean advised. So the doctor advised to you give the paracetamol tablet for the patient. So you have to follow that. And the next point is to teach self-care and counseling on health matters. So as a staff nurse, you have to give the counseling regarding the health matters, nothing but nutrition, medications, exercises, whatever it is related to the all good health. And the next one is to supervise and guide the patient rehabilitative activities. It is nothing but in the rehabilitation is nothing but uh, at the end of life. Okay, for the old age people, they are staying in the rehabilitative centers and the old age homes. Okay, some of the patients, some of the person who are addicted to some kind of alcohol. Okay, it is nothing but it is totally life changing procedure is going to happen in the rehabilitative center. So as a staff nurse, you have to supervise and guide the patient in rehabilitative activities. The next one is to participate in the research work. So as a staff nurse, you have to do some research to find out some solutions for the problems. That is nothing but research. And maintain a good communication and a therapeutic relationship. So as a staff nurse, you have to maintain the good communication with the patient and a therapeutic relationship between the nurse and the patient. And the next one is to maintain her own physical and mental health. So as a staff nurse, you also have to maintain your own physical and mental health. Then only you can give the a best care for the patient. So these are the point you have to remember when you got the question like what are the functions of professional nurse, because you are the first year BSc nursing or GNM students. So this kind of questions the teachers may ask. The next question is what are the code of ethics. Okay, what do you mean by code of ethics? So code of ethics are nothing but the nurse provides services with respect to human dignity and equal of client, unrestricted by consideration of social and economical status. So it is nothing but the staff nurse, she has to give a respect for the human. It is not based on the patient economy, patient okay, whatever it is, I mean status, economy, education. So you should not look all of this. You have to give the equal importance for the all patients. And the next point is the nurse has to safeguard of client rights to privacy and to protecting information of confidentiality matters. So it is nothing but as a staff nurse, you have to uh, keep some of the matters, sensitive matters, nothing but for example, if the patient is having HIV/AIDS, so you should not tell to anybody. So this patient is HIV patient. You should not go to the near to this patient. So this kind of matters you should not tell in the I mean in the hospital or somewhere else. Next one is the maintain ethical and legal practices of any person. So in the hospital area, you have to maintain ethics and legal practices. Nothing but it is legal is nothing but according to the according to the I mean legal uh, justice. Okay, all this kind of you have to maintain with the any person in the hospital, and to promote health and to prevent illness. Promote health is nothing but improving the health status, and to prevent illness. Prevent illness is nothing but to prevent the occurring of disease in the person and restore the health, avoid suffering. So these are the some of the code of ethics of nurse. And the next one is what is the role of a nurse. Okay, previously we have seen the functions of nurse. So here is the role of nurse. So as a nurse, she can being the a caretaker, okay, caretaker of any old age people, okay, any children, so any person like that. And the decision maker. So these are the other qualities of a staff nurse: decision maker, protector, patient's advocate, manager, rehabilitator, communicator, teacher, nurse educator, clinical nurse specialist, nurse practitioner, nurse midwife, nurse anesthetist, nurse administrator, nurse researcher. Okay, so these are the qualities of a and the role of a nurse. So she has to perform all these uh, areas. Okay, she has to be the caretaker, she has to take the decisions, and she has to protect the patient. And the patients she can become as the advocate is nothing but she can give the a good suggestions for the patients, what is right and what is wrong. And she has to be the manager in the ward and a rehabilitator, communicator. So these are all the role of a nurse. So you can give these points when you got the question of role of a nurse. And the next one is, what is the definition of hospital? So the hospital is an integral part of social and medical organization, the function of to provide for the population. Okay, so hospital is nothing but it is a medical and a social organization. So social is nothing but these hospitals are constructed in the society. Okay, social concentration and a medical organization and a medical people, so they have to organize the hospital for the function to provide the population complete health care, both curative and preventive. Okay, this is not creative, curative. Curative is nothing but cure. Okay, prevention of illness is nothing but curative. So the hospital, it has to work on the both curative and preventive outpatient service to reach the family and its environment. So the hospital, she has to it has to organization of social and medical, and this function is working on the curative and preventive services and outpatient services to reach the family and its environment. So this is the a simple definition for the hospital, so you have to remember it. And the next one is Maslow hierarchy 5 level basic needs. So the madam, the teachers can ask about the what is the Maslow hierarchy model. So in the Maslow hierarchy model, the author, he has explained the needs of the person. So the first one is the physiological needs. So this is the pyramid. Okay, so Maslow, he has created a pyramid. So in this pyramid, the basic needs, I mean physiological needs are first one. I mean the lowest one is the physiological needs. So in this we have food, water, and warm and rest. Okay, these are the physiological needs. Every person needs this physiological needs. And the next one is a safety needs. Okay, after physiological needs we have safety needs. Safety needs is nothing but security and safety. And the next one is a belongingness and love needs. So every person needs to in a relationship and friends and love. Okay, so this kind of emotional feelings everyone will have. So these are the third level of hierarchy model. And self-esteem needs. So in this, prestige, feelings, accomplishment. Okay, so these are all the psychological needs. And then last one is the self actualization. Self actualization means self fulfillment, own self, I mean achieving own's full potential including creative activities. I mean self is nothing but own person feelings. So these are the 5 level of hierarchy model. First one is the physiological needs are the lowest one, safety needs, love and belongingness, self-esteem and self-actualization. The next one is, who is the founder of modern nursing? So simply we can say Florence Nightingale. And the Florence Nightingale was born in 12th May 1820. And who is called Lady with the Lamp? Florence Nightingale. So these are the very important questions for the BSc Nursing first year students. And Miss Florence Nightingale was born in England. Why? Because she's not married. So that's why this is Miss Florence. And the next one is, what are the determinants of health? So determinants of nothing but the points. I mean, based on what we can say it is a good health. That is nothing but determinants. So in the determinants of health, first one is a physical and a biological. So physical is means physical health, biological means it is related to the body, and psychological, cognitive and intellectual, religion and spiritual. So when the person is having all these determinants in a good manner, so we can say the person is good health. Okay, so we can say that the person is having the good health. So these are the basic determinants of health. So the next one is, what are the departments you know in the hospital? So for the first year students, the teachers may ask this kind of questions in the Viva. So in the hospital, what are the types of departments we can see? So the first one is emergency department. So in the emergency department, we will give the emergency treatment for the patient. And the next one is the medical department, surgical department, psychiatric department, pediatric department, operation theater. So in the medical department, we give the treatment for the medical conditions like dengue, malaria, fever. So all this kind of treatments we can give the medical department. And the surgical department is nothing but when we do when the doctors has done the surgeries for the patients. Okay, and the psychiatric is the mental disorders, and the pediatric is the children's cases, children disorders. We can give the treatment in the pediatric department. Operation theater is nothing but it is not a movie theater. Operation theater is conducting surgeries. So it is called operation theater. Orthopedic department is related to the bones. Okay, bones, joints. Okay, so the treatment we will give the bones and joints in the orthopedic department. Dermatology is nothing but it is related to the skin. And the next one is a ophthalmology department. It is related to the eyes, nose and ears. So mainly ophthalmology is related to the eye, and the pulmonology related to the lungs. And CSD is nothing but Central Sterile Supplying Department. So in the hospital we have to maintain the sterility. I mean sterility is nothing but prevention of infection. So all the items and the surgical items, tools what we use in the treatment, so all this material is steriled in the central sterile supplying department only. And administrative department, so in the administrative department, the department people they maintain the records and reports related to the patients and the hospital functions. So the next question is, what is the meaning of admission of the hospital? So in the hospital, what do you mean by admission? So admission is nothing but when the patient is come to the hospital for the treatment, it is called admission process. So when the person is coming to the hospital for the treatment, that is nothing but admission. And the next one is, what is the meaning of transfer of the patient? So the transfer is nothing but the patient shifting from one ward to another ward. That is nothing but transfer. And the next one is what is referring? Okay, referring is nothing but the patient transferring from one hospital to higher hospital for better treatment. For example, in a small hospital, the patient doesn't taking. I mean. the sufficient treatment what the people are not giving the for the patient who require the good treatment. I mean, for example, if the patient is came to the PHC, primary health center, that is a small hospital, okay. So in the PHC we don't have the ventilators and emergency equipments, all these things. So immediately the PHC hospital refer the patient from the PHC to CHC, community health center, otherwise private hospitals. So this is called referring. And the next one is what is discharge. So discharge is nothing but leaving the patient from hospital after completion of the treatment. So when the patient come to the hospital, it is admission, and he will take the treatment and the disease is reduced, okay. And finally, for the whole year, he cannot be in the hospital. So at one time after completion of the treatment, he has to leave the hospital. That is nothing but discharge. And the next one is what is LAMA. So the LAMA is nothing but leaving against medical advice. So the patient is not the patient is not satisfied with the treatment what we are given in the hospital. So he wants to go other hospital, otherwise he wants to go to the home. Okay, so whatever it may be. So he is leaving against the doctor advice. So the doctors are telling that you should not go to the house. You have to take that treatment. But that patient is not willing to take the treatment. So in that situation, if we go from the hospital, that is nothing but LAMA, leaving against medical advice. And the next one is what is communication. Okay, this is very important question. What is communication? So the communication is a process of exchanging of ideas and feelings between two person. It is called communication. So the communication is nothing but sharing of feelings and ideas between the two persons. So the steps or communications are source. First one is the source. Source is nothing but, for example, it may be the telephone, it may be the mic, okay, the electrical device, whatever it may be, and encoding of the message. So we are typing the message. For example, if you take the mobile phone in the WhatsApp, so encoding is nothing but typing the message. Channel is nothing but WhatsApp, Instagram, and Facebook, YouTube, okay, whatever it may be, and a television. So like that. And decoding is the receiver. So receiver will read the message, and the next one is the next person is the receiver. Finally, receiver. So these are the main steps. Are first one is the sender, and a channel, and a receiver. So these three are the main points. But in that source, encoding, channel, decoding, and a receiver. So these are the steps of communication. So the next one is models of communication. I mean, types are communication. It may be the verbal and non-verbal. So the verbal is nothing but speaking in the words. Okay, I'm I'm speaking right. Okay, so this is verbal. Non-verbal is nothing but gestures, movements. Okay, eye movement, body language. Okay, when you see the some person body language, you can understand some manner, some matter. Okay, so it is nothing but non-verbal, verbal, and non-verbal. So the next question is what is recording and reporting. So the recording is a communication of information to another individual. Maybe it is in the written or oral format. So the recording is nothing but it may be the oral or written, maintaining the records. So this is called a recording. So the reporting is a oral written exchange information. Reporting is nothing but we are writing the matter in the records. Okay, so and so patient came to the hospital, admitted in the surgical ward. Okay, he has taken the total treatment. So all this information what we write in the record is nothing but reporting. Recording. Reporting is nothing but it may be the oral or written. For example, reporting to the physician. For example, the patient is not taking the treatment. So as a staff nurse, she has to report to the doctor. Okay, that is nothing but reporting. I mean telling. So the next one is, what is nursing process? Okay, this is very important question. So the nursing process, it is a series of planned steps, action directed at meeting of needs and solving the problems of patients. So the nursing process is nothing but it is a planned activities to maintain the and uh, to to meeting the needs of the patient and solving of the patient's problems. So this is nothing but nursing process. So in the nursing process, we have the 5 steps. First one is the assessment. So in this assessment, we are assessing the patient condition. Okay. So what type of disease? Okay. What is the problem? Okay. So all this assessment will come under the assessment step. And the next one is the diagnosis. So after assessing, you will understand some of the information. So then you can go for the diagnosis. So the patient is having this kind of disease. So like that. And the next one is the planning. So in the planning, you will plan the treatment for the patient. I mean regarding disease. Okay, what type of disease the patient is having, you diagnosed, and you will plan for the treatment or the care. And after planning, what you will do, you will implement is nothing but giving. Okay, whatever you planned, you giving to the patient. And the next one is the evaluation. So evaluation is nothing but how far the treatment is effective to the patient. Okay, that is evaluation. Again, rechecking whether it is effective or not, whether it is useful or not, that is come under the evaluation. Next we will see the positions. Okay, patient positions. So first one is the supine position. So supine position, it is a simple, the patient is lying on the bed. This is called supine position. So in the picture you can see the supine position. So the next one is a prone position. Prone position is nothing but it is opposite to the supine position. The face, chest and genitalia and knees, so everything is faced towards the floor. Floor is nothing but bed. So it is reversed to the supine. Next position is the lateral position. Okay, lateral position is the it may be the right lateral or left lateral. So when the patient is in the right lateral position, right hand, okay, right thigh, so feet, everything is right part of the body is touching to the floor. Okay, that is lateral position. So the next one is a Fowler's position. So Fowler's position, in this the person head, okay, elevated. The person head is elevated. You can see the person. This part is elevated. It is called Fowler's position. So in this Fowler's position, we have the 90-degree, okay, 90-degree, semi-Fowler's, low Fowler's, high Fowler's, semi-Fowler's, low Fowler's. So these are the types in the Fowler's position. Next one is a Trendelenburg position. So in this Trendelenburg position, the head of the patient, I mean upper part of the body is downwards, lower part of the body is upward. Okay, you can see the picture. This is Trendelenburg position. And in this Trendelenburg position, reverse Trendelenburg position is nothing but the lower part of the body is downwards and upper part of the body is upwards. So this is the Trendelenburg position. This is the basic Trendelenburg position and this is the reverse Trendelenburg position. And the next one is a knee chest position or genopectoral position. So in this position, the patient's chest and face and knees, okay, all these parts are touching to the floor. This is called knee chest position or genopectoral position. And the next one is this is the last one is a lithotomy position. So in the lithotomy position, the patient legs, okay, the patient legs are elevated. So this position mainly for the female vaginal examination or in the during the normal delivery of the baby. Okay, in these situations we can follow the lithotomy position. So thank you guys for watching my video. This is my first video in this channel. Myself is Vamshi Krishna, completed MSc Nursing in the SVS College of Nursing, Mahabub Nagar. So this channel is mainly for the only students like BSc Nursing and GNM and even MSc Nursing students. Thank you.